Good morning, everyone. I am Aaleha Izza Baliwan from the SN1A, and now I am going to show you I am going to do an administration of intradermal and subcutaneous injection. So the first thing that I will do is to check the physician's order, and then I am going to assemble all the equipment. So the equipments are all here, and then with the medication ticket, and then now I am going to wash my hands or sanitize my hands to prevent the spread of infection. And then I am going to put my gloves on to maintain the sterility of the syringe. And then after that, I am going to check the patient's history of allergy, if he or she has an allergy on some medications. And then now, I am going to assemble the equipment and put it in the medication box. And then now I am going to change the aspirating needle into G26 or G25. So now I am going to take the ampule and then and make sure that it is not towards you, and then dispose. And then now I am going to take the right dosage. And then now, make sure that there's no bubbles. And then now, for the vial, now I am going to change again the aspiring needle.
Nung nagkaroon, ito na po, nagkakita na po. Kaano ba kadalas ang
Again, I am going to take the right dosage.
isa kinukuha niya po, may 14, may 10, hindi po parehas. Tapos mabait naman po si Ma'am Jocelyn sa amin. Pag nagsisimba po siya, minsan po may dala-dala po siyang pambigay po sa mga tao doon, nagbibigay po siya ng mga pansit, mga nakabalot-balot na po. Lahat po ng tao nagbibigay niya po. Tapos may simbahan po. Bukod sa
Then
simbahan
take.
po din po sa tao binibigay. Malaki tulong din po yung binibigay sa amin ni Ma'am Jocelyn.
Ito. So, nakabalot sa ganito. Okay?
Siya. Tapos, kasi may ano po ito eh, may kapon siya. Tapos, kung pinabalot po namin siya ng gano'n. Ganyan po.
I-offer.
Na-offer po niya. Ganito po siya.
Magkano usually ang kumikita mo dyan, ate? Kapag kilo, isang balot. Ganyan, magkano ang kumikita mo?
Ito kasi sa isang balot, kapintahan lang po namin dito, na higi. Tapos, kumikita po kami sa isang tray.
And now,
po kami ng
shake it
sa
like this to so that it is properly mixed.
800, 1,000. Kapag mabili po, kapag hindi naman po mabili, ay 500 lang. Tama lang sa pagkain natin.
Yung nangyari itong pandemic, ate.
And then now, get or check it with the medication ticket.
Nung ano po, siyempre sa tagal din.
And then check for the right dosage
Gusto ko na mag-text po kay Ma'am Jocelyn
that you need to get. And then don't forget to check the manufacturer's date and the expiration date of the vial or the medicine.
Si Ma'am Jocelyn na po talagang nakakatulong. Nakasa po talaga na may mabait na kalooban po na tutulong po sa mga ganyan. Jocelyn, sana po matulungan niyo po ako sa pagkikita na to. Maraming salamat dahil tulong niyo po sa amin. May po tayo makakaraos kami sa ulang namin. Maraming salamat.
Ayun, ate, dapat na ang nais mo ay dasal-salis ko at tama. Ay, tingnan natin ang mga kailangan. Salis-salis ko at papadala natin ang iyong nais na negosyo sila idol at Ma'am Jocelyn.
Sige po, salamat po. Ma'am Jocelyn, maraming salamat po.
Make sure first to get some air. Make sure that the numbers are faced towards you. Now I'm going to set it all aside. Now I am going to carry the tray to the patient's bedside. So it's already here, and then now I am going to confirm the patient's identity by asking or the patient's identity. So now, ma'am, so now I am going to inject the patient with the right dosage as it is in the medication ticket. So now I am going to stretch skin by pulling skin to the back of the arm with the non-dominant hand, and then place a plunger almost parallel at 5 to 15 degrees to the patient's head with the level up. And then now, I am going to inject it to the patient. But I am going to clean the area with cotton with alcohol. So now I'm going to inject the area. With 0.0.
Dalas lang sila po, no? Pagdanda ang gianan.
And then now I am going to withdraw the needle slowly and pat the area with a dry cotton ball. And then now I am going to encircle the area with a black or a blue ball pen. And then now I am going to note the administration, the time, and the site at the back of the medicine ticket.
Pinigay niyo po sa amin. God bless po. Sana po marami pa po kayong matulungan. Sa tuwa po, pinigay niyo po sa kanila na sa pagkapo.
So now, let's just assume that it's already 24 hours and then the patient didn't show any allergies on the medication that we just injected. So now for the subcutaneous injection, I am going to do the same procedure but the only difference is that when you inject with 90 degrees and then inject it in the fatty parts of the body such as thighs, abdomen, or in the arm of the patient. So now I am going to inject the patient with 90 degrees. So now I am going to withdraw and then again record time and date of injection, record the time and date of injection on the time and date of injection is the amount, site, and route of administration, as well as the patient's reaction. And then put it in the nurse's note. So now I'm going to put it in my notes. And then now I am going to dispose all the equipments that I have used. And then again, let's assume that it was already 24 hours, and then the patient didn't show any allergies or allergic reaction towards the medications that we injected. And then and then after that, thank the patient for the cooperation. And then that would be all for my intradermal and subcutaneous injection.